Hi, my name is Dr. Sean Johnston. Today we're going to be talking about pain in pregnancy. For those women who have been pregnant, 50% of you more likely than not had low back pain. In fact, that first pregnancy, this is when most women experience low back pain. The majority of the women, when they experience low back pain, it's in between the 20th and the 28th week of gestation. That's whenever you're more likely than not going to get that low back pain. So there's generally two types of pain that you'll experience. One is low back pain or lumbar pain, and the other is pelvic girdle pain. So I kind of want to break those two types of pain down for you so that we can understand them. There are two types of pain, lumbar pain and pelvic girdle pain. It's really easy to tell the difference between these two types of pain because of their location. Lumbar pain stays exactly where it says it's at, the lumbar spine. Sometimes that pain can go down to the toe, and that is caused from nerve irritation. But generally, in pregnancy, what you're going to find with lumbar pain is it stays right there in the small of the back. There are several ways that you can treat lumbar pain during pregnancy. Some that have been proven are acupuncture, stretches and exercises, chiropractic manipulation, and massage. Those tools are very effective in treating the lumbar pain and have been proven to help. The second type of pain is the most common type of pain, and it is pelvic girdle pain. This type of pain starts at those dimples in the back. If you take your thumbs and you put it behind your back and you feel those two little dimples where the bones meet and protrude out a little bit, that is where the pain originates. And it can travel from that little dimple or the SI joint and travel into the buttock and down to the back of the leg, really portraying itself like Piriformis Syndrome. The reason why this little dimple in the back causes so much havoc on the body of someone who's pregnant is because of a little hormone called relaxin. Relaxin is there to produce laxicity to the ligaments of the pelvis. That pelvis is trying to prepare itself for a baby to come into this world. So it is allowing that pelvis to grow and to expand. As it is expanding, some pain can be felt in this region. So one way to combat this pain is to improve the stability of that pelvis and the hip. So we're about to show you an exercise that can improve the stability of the hip and prevent you from getting the most common pain, which is pelvic girdle pain. So this first exercise is called the Clam, and its goal is to bring stability to the SI joint. So you start with your feet in line with your buttock and your knees and your legs at a 90-degree angle. Make sure as you're doing this exercise that you do not rock back. You want to make sure that your pelvis stays perfectly straight up and down and that you're not rocking. So to start the exercise, you will open your knees to the point right before you start to rock back and then close. Open and close. You can do this for 3 sets of 10. And if you want to add additional weight, you can take a TheraBand and you can tie it around your knees to give more resistance to the exercise. This next exercise is the warrior pose. It is a common exercise in yoga. So what you do is you bring one foot in front of the other, bend at the knees, and bring your arms above your head. So the hard part about this exercise is to make sure that your lumbar spine stays straight. So one thing that you might want to do at the start is to bring one hand to your stomach and one hand to your back to ensure that your lumbar spine is straight. So bring it to a neutral position. Then bring your arms back up. This is causing more extension in the hip. So you can see Caitlin's left hip is being extended. This hip is the one that is back, and that is the one where you should feel the stretch in the front of your leg. So drive your right knee forward, and you can see how that left leg is needing to go back even more because that lumbar spine is staying straight and she is getting a stretch through the hip. So as she straightens up, and comes back again. Notice how the lumbar spine stays straight, but that hip is coming back. If you are pregnant and are experiencing low back pain, or you know of someone who is pregnant and experiencing this low back pain or pelvic girdle pain, feel free to give us a call at 565-4200 or look us up on our website at myreliefplus.com. My name is Dr. Sean Johnston, and I would love the opportunity to help you out.